From 12 News, this is Newsmakers.
A new plan to tackle Rhode Island's healthcare crisis. Attorney General Peter Neronha this week rolled out a series of proposals he says will help stabilize the system, including a bill that would immediately increase Medicaid reimbursement rates, a fresh lawsuit against CVS and other pharmacy benefit managers, and more.
We are in a state today of spectacular failure that is literally occurring before our eyes.
The stakes are high, but so are the potential costs to taxpayers. We break down the ambitious plan with our guest, Attorney General Peter Neronha. Welcome to Newsmakers. I'm Tim White alongside 12 News Politics editor Ted Nesi, and we welcome back to the program Attorney General Peter Neronha. Good to have you.
Hi, guys.
A lot to talk about, and there are several pillars to your plan that you titled Way Forward, the Case for Systemic Healthcare Reform in Rhode Island. And I want to begin with reimbursement rates. In short, you have a bill that would increase Medicare reimbursement rates by July 1st, right around the corner. Your office estimates that it would cost somewhere around $50 million in the coming fiscal year. The Assembly is in the final month of their session. What is your sense about the bill's chances of passing right now?
You know, I think it's unclear. I think we have to start with a premise, though, Tim and Ted, that fixing it's not optional. So what's happened just in the course of this session, and those reimbursement rates are to raise Medicaid to Medicare rates, and there's a big difference, 37 to 100 to 200. So Medicaid, $37 for a visit, $100 for Medicare, $200 for commercial. Raise Medicaid to Medicare. For primary care, what have we seen about primary care in the course of this session? Anchor Medical closing 25,000 patients, primary care patients in the wind. Fixing it's not optional, so I hope that the General Assembly will recognize that.
Are you talking to them now? Because we're in the red zone.
Yeah, I've been talking to them all session. Look, it's not a surprise. Some people get tired of me talking about healthcare. I've talked about healthcare to you guys and others publicly. I've spoken to Rhode Island voters about it and residents about it. I've spoken to the Speaker about it. We had dinner, just the two of us. We spoke about it. I've spoken to the late Senate President, the current one, about it. A lot of this is also tied to my very real concerns about Roger Williams and Fatima hospitals. That's the broader issue of reimbursements.
But what is the Speaker saying about this bill?
He says he's got to, look, that it's a tough year. But my answer to the Speaker, with great and deep respect, is this is not optional. So when we budget, even if it means going back to the drawing board, we've got to find this money for primary care in particular now, or our system will fail. It will fail. And so we worry about healthcare when the budget's already done. No, we should be talking about healthcare when we start. But even if we've already started, if we never thought about it in the first place in some quarters, maybe then we have to go back to the drawing board and find it now. So the governor just found $10 million just the other day.
For Fatima.
Exactly. We think conservatively this would cost $50 million for primary care. But remember, we're getting $2 for every dollar we put in. What an investment we could make to stabilize primary care for Rhode Islanders so that every Rhode Islander could find a primary care doctor almost immediately. So look at it this way, okay? Yes, July 1st, but we could do this in a way so that it would be retroactive. Give the state EOHHS time to figure out exactly the mechanics. But we can make this work and we can make it happen very quickly. But if we don't, Rhode Islanders are still going to be struggling to find health care, which will make it more expensive because then you go into the ER, and that's exactly the wrong way to do primary care.
Let's drill down on that because we have been talking about this a long time.
Yeah.
And I feel like the whole time I've been a reporter, I've been covering a series of slow-moving crises in the healthcare system, Memorial closing, the ongoing problems at Roger Williams and Fatima, the growing doctor shortage, et cetera. Do you think it will continue to be death by 1,000 cuts, like a slow burn, whatever metaphor you want? Or do you think there's like a tipping point would be reached where problems would start to cascade and get worse faster?
Yeah.
What do you think would be coming if something dramatic isn't done?
Well, I think we're seeing the tipping point when Anchor closes, not because they're poorly managed.
Because that is the sense we're getting from the administration, that this was unique. This is not about the primary care crisis. This was something strange.
Let's talk about Anchor Medical. I was in discussions with them in March. They signaled to me they could not make it work as reimbursements are right now. now. They didn't go into bankruptcy. They were not an irresponsible practice. They just wound it down because they knew they couldn't make it. They didn't want to leave vendors in the lurch. God, give them credit for that. Don't criticize them. Just the wrong narrative. The right narrative is you can't make it any longer. When my wife started as a primary care doctor here, she could practice with 2 other doctors. That day is long gone. The big systems are subsidizing them by $150,000 per. So what does it look like? You're asking the right question. What's the tipping point? The tipping point is when Roger Williams and Fatima can't sell their bonds and close. They're going to go back to bankruptcy court. Look, we've done everything we can to save them. You know, going back 2 years and beyond to being in the bankruptcy court. We were there on day one. The bankruptcy judge really appreciated that. We think that's why we got them this chance. But if they can't make it, they go back to the bankruptcy court, and the odds of them closing are very, very high. So look, you really want to sell those bonds? I appreciate the $10 million, tip of the cap. But listen, you want to really save those hospitals? You want to sell those bonds? Raise the reimbursement rates. That will stabilize
For the viewers' sake, we're referencing a bunch of things. You and I both know what we're talking about, but I want to make sure we bring everyone along with us.
Sure.
So put the $10 million aside for one second. The bonds are this effort to sell Roger Williams and Fatima to a nonprofit. It's a whole thing to get them under new ownership, which has its own questions. But we are in the bonds. They're trying to sell them right now. You pay very close attention to them. What are you hearing right now about how the bond sale is going?
Well, I think they're selling some, but not as many as they need. And why do they need to sell the bonds? Because they're going from a for-profit to a nonprofit. There's no endowment like some of our nonprofit hospitals. Now, I've got $50 million, and I'm prepared to give them that we squeezed out of the former for-profit private equity owner of Big Prospect. So there's a start, but they need the bonds to get off the ground, sell the bonds to get off the ground and generate cash. But the reason why those bonds may not be the kind of investment that some investors like is because for those hospitals to succeed, we've got to raise our reimbursement rates. So if we don't bite that bullet and realize that it's not optional, those hospitals close. Boy, you got a big problem then, because you got a lot of beds that can't be replicated elsewhere, and at a minimum, you've got 80 to 90 behavioral health beds that Butler can't take.
All right. Going back to end the segment on the reimbursement rates, Governor McKee was on, I want to play something for you. He was on 12 News at 4 last month, and Kim Kalunian asked him about increasing reimbursement rates. Take a listen.
Governor, is it time to stop studying the issue of reimbursement rates and just raise them so we can be more competitive with Massachusetts and Connecticut?
On the areas in terms of reimbursements, we for the second year we have put in our budget. Hopefully the General Assembly does pass it, which is a review of the rates. That's the first step to doing something. So you have to get the information before you can actually determine what the remedy is. But I think raising the rates makes sense.
So look, it does seem like a lot of numbers are being thrown around. You say $50 million. There's been a $90 million figure out there, and the governor's point is the state needs to get its arms around that and needs hard numbers.
Yeah. Well, listen, I think what he's saying there is we need to study the problem more. We know that further studies will not stabilize the problem that we need to stabilize right now. And the $90 million is for something different. Yeah. Mine is for primary care only. It's specific codes for primary care doctors. Drives that money very narrowly into primary care. The $90 million is for the hospital systems as a whole. So we're talking about two slightly different things.
But that also means we're talking about $140 million to do what the hospital executives were on here asking for a couple months ago.
No, Ted, no, it's not, because my $50 million, if they did the $90 million, then my $50 million would be subsumed in it, provided they sent it to primary care the way they should. But I'm not confident the General Assembly is going to do the $90 million. Okay. So what I'm saying is do at least the 50 to get primary care stabilized so that everyone can find a primary care doctor and our overall health outcomes will be better. But we can't study it further. Everyone knows what the problem is. Everyone knows that the rates are too low relative to our neighboring states, and we have to fix it.
So on that, we got to go to a break, but 30 seconds. If this bill is passed, would Medicaid rates be at the same reimbursement as Massachusetts?
It would be at the same level as Rhode Island Medicare, which is not.
But that's not a yes.
Well, it isn't, because listen, would I love to do more? You bet. But I also understand that We can't get all the way there in 1 year, but this will stabilize our system. It'll stop the hemorrhaging and start to begin the improvement. And we have to start somewhere.
All right, we're going to take a break. But when we come back, part of the plan is suing pharmacy benefit managers, including CVS. Stay with us. You're watching Newsmakers. Welcome back to Newsmakers. I'm Tim White. This is Ted Nesi. Our guest is Attorney General Peter Neronha. This week, your office filed an 87-page complaint against pharmacy benefit managers, or PBMs, including CVS Caremark, Express Scripts, and Optum Rx. You accuse them of engaging in, quote, deceptive and unfair practices. Just broadly, is the end game here to eliminate PBMs?
I don't think they're necessary. Yeah, and they drive drug costs up. And here's how. So they have been held out for a long time. They've held themselves out, that's our allegation, as saving us money on drug costs. They're hired by our health insurers and effectively to keep drug costs down. But that's not what they've done, and that's the basis for our allegations. What they have done is this. They decide how much of a rebate they're going to demand from a drug manufacturer, meaning how much of a kickback are they going to get for putting that manufacturer's drug on their list of drugs we can access. So if you don't pay the kickback, the drug that you make doesn't get on the list of things that your doctor can prescribe. That does a whole host of things. First of all, that's why sometimes we're forced to switch drugs, because drugs are moving around between the formularies or the lists. So manufacturer won't pay the rebate anymore, has to go to another one, or the rebate's higher. So it forces us to change drugs when there's no reason to do it. Not cheaper drugs, different drugs. Big distinction. So there's that. And these are in the hundreds, if not thousands of dollars. So what happens is the manufacturer then raises its list price to help make up for the rebate. And then when you go in, if you have coinsurance, and even if you have a copay, and particularly if you're paying for the drugs yourself, your drug costs skyrocket. So when we talk about fixing healthcare, we got to bring costs down, no question. We got to drive revenue up, no question. One of the ways that we drive costs down is to bring these PBMs to heel. Look, General Assembly wants to eliminate them tomorrow, God bless. But since they and the governor haven't acted yet, well, we're going to act, and we think we can really help Rhode Islanders in this way.
You know, we should point out CVS disputes everything that you just said, and they really leaned into the importance that CVS plays in Rhode Island. I want to read you a statement from one of their spokespeople. They wrote, "It's surprising and unfortunate that Rhode Island's Attorney General would use biased and incorrect assertions about our industry to needlessly attack a hometown company. CVS Health contributes nearly $3 billion of positive economic activity in Rhode Island each year, and we employ more than 7,000 colleagues across the state. Is there a risk to attacking one of the state's largest employers?"
It's not an attack. It's holding them to act lawfully.
A civil complaint to try and eliminate PBM is not an attack?
Yeah, when they're costing Rhode Islanders hundreds of thousands of dollars in drug prices every year. Look, the same drug in Germany costs $59. It costs nearly $1,000 in Rhode Island because of PBMs. Listen, with respect to CVS, this is the same company that pumped opioids into our neighborhoods over a series of years. So spare me the outrage. Follow the law. Treat Rhode Islanders like the responsible company I know you can be. I get my flu shot at CVS. I love the people who work there. But this is about corporate profits and corporate greed. And I don't care if they're the home team. It's like asking me, well, don't charge the Speaker of the House when you're a U.S. attorney because he's the hometown speaker. I don't care whether he's a hometown speaker or not. I don't care if he's the most powerful player in the state or not. When we went up to Gordon Fox's office, we went, and if
Gordon Fox didn't employ 7,000 people in Rhode Island.
But he was the most powerful man. What's my point? You don't get a pass because you're powerful or you're wealthy or you make a contribution to the state. Follow the law and you'll be fine.
So, you know, one thing we heard repeatedly from people as you made the big healthcare announcement this week was folks view it in the lens of politics. And they say, oh, well, he's setting the table for his run for governor. And I know you're probably going to be quite dismissive of that. But I didn't necessarily think of it that way because I know how long you've been talking about healthcare and it sort of flowed out of that. But what do you say to the viewer who's like, oh, I've seen this movie before. A politician angling for their next job makes bold announcements and puts the current guy on blast about what he hasn't done yet.
Yeah, look, so if you go back to when I was sworn in for my second term, I talked about two things that we needed to focus on. Rhode Island, if we didn't, we were going to pay a heavy cost. One was climate, the other was healthcare. I said, we have to fix healthcare. Those were my words then. They have been my words ever since. I had 7 amazing lawyers standing behind me. What we rolled out this week was something we've been working on since the Lifespan of Care New England merger didn't go through. I don't like saying no, right? I want to be part of a solution. We knew then that many or some would say that denying that merger was all well and good, but what do you have to say, Mr. Attorney General, about what comes next? And I challenge my team. We've got 18 months at the outside to come up with a plan. Let's work together to come up with one. It may be a fool's errand, but let's try. Well, they did it, and so we rolled it out. It had nothing to do with politics. Look, when we're so cynical that we confuse a good plan with politics, well, then maybe we just need to rethink. Maybe we just need to think more about our politicians, but I guess I understand in today's environment why we don't.
Well, and to that point, you have, we've watched you go back and forth a little about, maybe I'll run for governor. Maybe I'll run for lieutenant governor. Yeah. Now you're back to talking about maybe I'll run for governor.
An emotional roller coaster to follow
everyone.
Yeah, look.
Where's your head at today?
Yeah, look, I've had a couple of, frankly, health-wise, difficult years. I mean, I had major surgery 2 years ago, so that's driven some of my thinking. Look, people have come to me and said, look, run with me as my lieutenant governor. And I appreciate that confidence in me. I think, that had some appeal because it was issue focused. As I said here today, I don't know what's next for me. I love public service. These are problems that need to be fixed. And if I think that I can help lead something to help get them fixed, then I'll consider it. But yeah, look, these have been a roller coaster 2 years for me personally, frankly, and so to some extent that's informed my thinking. But I don't know that other people don't go through the same thing. I guess what's been different about me is I've tried to be candid about it. Some people will just tell you I'm still thinking about it.
All right, we got to go to a break, but real quick, when do you have to decide?
Oh, I think this summer.
Okay.
Yeah.
You'll have a decision this summer.
I think
on whether
so,
you're
yeah.
gonna run or not. Okay. We're going to take a break on Newsmakers. Our guest, obviously, Attorney General Peter Neronha. Stay with us. You're watching Newsmakers. Welcome back to Newsmakers. I'm Tim White. This is 12 News Politics editor Ted Nesi. Our guest this week is Attorney General Peter Neronha. General, I was down at Washington County Superior Court for 6 weeks in Judge Thunberg's courtroom for the criminal trial of former North Kingstown High School basketball coach Aaron Thomas. He was acquitted of the 2 most serious sex crimes in the naked fat test case. He was found guilty of 2 misdemeanor battery counts. Each of those comes with up to a year in prison. As all misdemeanors do. What is your office going to seek leading into sentencing scheduled for June 26th?
Well, I think it's a jail case. I'm not under any illusions that Judge Thunberg will impose it. Maybe she will. I don't know. Look, I feel my heart is really with the victims in that case, and and they are victims. Let's not make the mistake about that. The jury did convict the defendant of a battery, and so. Battery on a child? I mean, you can try to defend that, I suppose, if you want, if you're this coach.
Are you going to seek the 2 years, the max?
Yeah, I haven't talked to the team about that, but the conduct is outrageous. I mean, who takes children and asks them to get out of their clothing in a room with brown paper over the window? I don't think I need to say much more than that.
We talk a lot when we just work about your political future, but someone has to replace you because you're term limited. I know you'd like to keep the job you've said, but you're not allowed.
It's a great job. Highly recommend it.
Who do you think is going to succeed you? Who's going to run?
I don't know. You hear names, but I don't want to speak for them. They haven't announced yet.
Are people calling you, quizzing you about what to do if they want to run?
Some do and that make noises about it, and some don't. I think that it's a great opportunity to help Rhode Islanders if you look at the job expansively. We talked about this once, about the limits of the job are really only what you're imagining. I mean, the powers are so broad that if you decide to exercise them in new ways, you can really make Rhode Islanders' lives better and different. And we tried to do that, and the team has warmed to that work. What I worry is that if the next Attorney General doesn't have the same approach, we might lose some really good public servants. But that's the next Attorney General's decision. I hope we get a good one.
Briefly, there's always a question for an incumbent in an office. Do I endorse a successor? Do I stay fully neutral in the race? Have you thought about that at all?
Well, no, not really. Look, I think if there were certain people who ran, like the former U.S. attorney, I'd endorse them. If my deputy ran, which
if you're watching, Zach, there you go.
I'd endorse him, and I've told him that. If my deputy ran, Dee Goldstein, I'd endorse her in a hot minute. There's nobody who knows more about how that office operates than my deputy. Like, sometimes I can't believe she is staying on top of all the things that she has managed to do. I think she'd be terrific. I don't know that she has the political will to run. So I would endorse those two in the beat of a flash of an eye, but beat of an eye, beat of a heartbeat, whatever it is. But others, I'd want to sit down and learn more about what their plans are for the office.
Even casual observers get the sense that you have a frosty relationship with Governor Dan McKee, to put it mildly. And I wonder if this animus on both sides is hurting the public's interest here in Rhode Island. You're tackling healthcare. He would argue so is he. And since both of you are always in a combative stance, the odds of the administration and the state's law firm and the Attorney General's office coming together to solve a problem are slim to none.
Well, we're working together on the bridge lawsuit. So yeah, the governor and I don't get along, but I've tried, and I'm going to continue to try, particularly going forward, to kind of put that behind me. It's just, I find
they're going to scoff at hearing that.
Well, look, if we're in a race together, for sure. I don't mean in that sense, but look, I've got tons of work to focus on. Like the Trump work is just so all-encompassing.
Is it 19 lawsuits you've been
Yeah,
part
we've
of
brought
so
6 here in Rhode Island. I'm really proud of that. We were really holding the administration to the letter of the law, and we've had great success. So look, but we're working together on the bridge lawsuit. The governor's proposal we've worked well with the Department of Health. We have EOHHS. Richard Charest and I have spoken about.
You've been pretty critical of DOH.
Yes, but nevertheless, we've worked well together. Terry Gray and I have worked together at DEM. I just spoke to Richard Charest at EOHHS last Friday about Roger Williams and Fatima. So the office's staff and I, actually, with the directors, have really strong relationships. Look, the governor and I will never get past ILO. We just won't. We look at it differently. He thinks of it as me being unfair to him. I look at it as doing my job. We'll never get past that. But we're working okay for Rhode Islanders where necessary.
30 seconds, you just mentioned the Trump cases. A lot of people noted that SCOTUS's 7-2 decision on the due process immigration case. Maybe they're going to be more open to some of these Democratic Attorney General cases. Do you have more hope for your chances at the High Court? Again, 30 seconds.
Oh, yeah. We're right on the law. That's why we're winning in the district court. It's not because the district court judges are, aren't elected or corrupt in some way. We're winning because we're right. And I believe that the Supreme Court, at least the majority, will stand up for the rule of law, and we'll win, and we'll protect Rhode Islanders and the broader state of the country.
20 seconds, yes or no. Doing all these cases in healthcare, are there things on the cutting room floor the AG's office would normally be focused on?
Always. If I could get more resources, there's so much more we could do. I'd love to do more in the nonprofit space. I worry about nonprofits doing the right thing. I worry about private equity in healthcare. But the governor vetoed the governor vetoed our tools to do that. We hope to get him again this year.
Peter Neronha, thanks so much for joining us. We'll see you next week on Newsmakers.